today to share with you, and we appreciate everyone joining us today. I am sorry to say Senator Height wasn't able to make it today, but we really do want to thank him for championing the meningococcal mandate in Ohio that goes into effect this fall. The law is really essential for keeping Ohio children's healthy, and we thank him for that. First off, I'd like to introduce Dr. Mary DiOrio. She's Medical Director of the Ohio Department of Health.
Good morning. Meningococcal bacteria is one of the leading causes of bacterial meningitis in the United States. Fortunately, Ohio's meningococcal vaccine school requirement will increase the number of adolescents in 7th and 12th grades who are protected against meningococcal disease. According to a 2014 survey conducted by the Centers for Disease Control and Prevention, about 74% of young people in Ohio between 13 and 17 years of age have received at least one dose of meningococcal vaccine that protects against 4 strains of this disease. This means approximately 25% of Ohio's young people are not adequately protected. While meningococcal disease occurs infrequently and sporadically, it's very serious and can be fatal. Meningococcal disease can be treated with antibiotics, and it's important that treatment be started as soon as possible. However, even with antibiotic treatment, 10 to 15% of individuals infected with meningococcal disease will die, and as many as 20% will have long-term disabilities such as loss of limbs, deafness, nervous system problems, or brain damage. There is a general rule that applies to vaccine use among populations. The greater the percentage of people immunized, the less likely disease will occur. Ohio has come a long way to increasing immunization rates among children since the 1990s. Back then, only about 40% of Ohio's children were fully immunized against the 3 commonly used vaccinations at that time. Today, current estimates are that 68% of Ohio children have all the recommended vaccinations by the age of 2. While this has greatly improved since the 1990s, we still have great work to do because 30% would still not be fully protected. For adolescents, Ohio has room to improve as well. As I mentioned, only 74% of adolescents have been immunized with 1 dose of a meningococcal vaccine. While children and adolescents are not fully immunized, Ohio remains vulnerable to vaccine-preventable diseases. There are numerous reasons in the past why children and adolescents have not been immunized on time, but fortunately, Medicaid expansion and the Affordable Care Act have increased access to immunization. The Affordable Care Act requires health insurers to provide recommended vaccines at covered costs when an in-network provider is used. In addition, the federal Vaccines for Children program provides vaccines at no cost to children and adolescents who qualify. And qualifying individuals include children who are Medicaid eligible, underinsured, uninsured, and children who are American Indian or Alaskan Natives. Parents sometimes need reminders for when their children are due for their vaccinations because the vaccine schedule can be a bit complex. Healthcare providers have been addressing this with reminder notifications, and the integration of electronic medical records has helped. And lastly, sometimes there's misinformation about vaccines that can cause parents to delay vaccinations. Public Health works with its healthcare partners, like the Ohio chapter of the American Academy of Pediatrics, to get information about the reasons for and the benefits of immunizations to parents. Today, ODH is glad to partner with Ohio AAP to educate parents on the new meningococcal vaccine requirement, to encourage timely immunization, and to provide resources for evidence-based knowledge about vaccines. ODH is pleased this year to fund and assist the Ohio AAP with the creation of a web-based application that will provide quick and reliable information on the importance of vaccines. And now I'd like to turn the podium over to Dr. Dennis Cunningham, an infectious disease specialist at Nationwide Children's Hospital.
Good morning. As the infectious disease doctor, I do treat patients who come in with meningococcal disease and other awful vaccine-preventable diseases. And while that gets a lot of the press, pertussis, whooping cough, there are other diseases out there, but I really want to focus on meningococcal disease for the simple reason is people die. And what is most scary about this, when you get the symptoms of meningitis, the very, very first symptoms look just like a common cold or flu. And yet, within 24 hours, people can die from this disease. And I'm not saying that to scare people or shock people. I just want people to know this is a serious disease. Not everyone I've untreated has survived, and we have a vaccine that's pretty good, it's pretty efficacious, and it's something we should all be doing. I really want to thank Senator Height. He has worked so hard with the Ohio AAP and other people to get this legislation passed. And we do have now in Ohio, we want children going into 7th and 12th grades to make sure that they have their meningococcal vaccine. It's very important for them. It's usually when kids start being together more, they tend to share things like glasses, utensils. Those are all ways you can transmit this disease, so it's so important. As a parent, I brought my kids to our pediatrician so that they could have all of their routine vaccinations, and I encourage everyone else to do so as well. While meningococcal is the focus today, there's certainly a lot of other good vaccines out there that people need. And we can't always be there to protect our children, but you can at least have some reassurance that if you're vaccinated, your child's going to have some protection, which is what I certainly want for my children, and I would be quite happy if I never saw another patient with meningococcal disease in my life. 1 out of 10 people can have deafness in either one or both ears. We've talked about people losing limbs, people getting bleeding into the brain and then brain damage. This is not a benign childhood illness. This is a really scary disease, and this vaccine has been amazing. It has a very safe track record, and I strongly encourage it, and I applaud the Ohio legislature for passing this legislation. Thank you.